Hey guys, Dr. Peru here. In this video, we're going to show you how to get rid of sciatica. Now, a lot of times the way people treat sciatica is completely backwards. So if you apply what I'm going to show you, it will be amazing. The only thing is you'll need some help from another person to do this, but I'll also show you how to do it on yourself. It's just more difficult. Okay, so let's show you how to do it. Sciatic nerve pain, acupressure technique, demonstration. Okay, so let's pretend this person has sciatic pain on the right side. Now, you have to realize that the sciatic nerve comes from this point, right through the buttocks, out down the back of your hamstring, all the way down through this way. If you have pain on the outside, through here, or the front, that's not sciatica. Sciatica is a big nerve, about the width of my thumb, all the way down here. So this is what you do if you have sciatica on the right side. The sciatic nerve comes right out of here, and you want to work on the opposite side. Okay, so you'll be pressing the opposite side of that nerve. You'll start right here, and there's a sacrum that comes here, and you're going to work right on this side. It's called the sciatic notch, and we're going to press in there, right in there, and we're going to trace down the nerve. We're going to trace down the nerve like this, okay? You're just going to stimulate the nerve on the opposite side. It's going to get rid of the pain on this side. Why? Because they're on a circuit. This is a stuck standing wave, and the way to get rid of it is to work on this side. Again, this is one of those things where you don't have to believe me, just do it, and you'll see it works. We press right down, we come right down the center of that leg, and you trace it all the way down. Now, what happens when you press on the opposite side? It's going to be very, very tender. It's going to be probably twice as painful as this side that hurts. And so I'm not going to get into why that's tender, but you're going to look for the tenderness. You want to go within that person's tolerance and just kind of work that nerve. Then what you'll do is you'll work on this side and you'll ask, okay, where does it hurt on this side? And they might say, well, now it shifted down here. Okay, then we can just do the opposite side over here, okay? Or maybe it's like lower on the calf, then we do the opposite side through here. The key is never, ever, ever work on the same side as the sciatic nerve. Work on the opposite side, and you want to get the mirror image. Start from the right through here, work all the way down, and you might want to spend like a couple of minutes working each spot all the way down to the foot, okay? So now one more thing. If you're going to actually do it on yourself, you're going to be laying on your back and you'll be sitting, okay? And you need a tennis ball or a racquetball, and you're going to sit right on this point, right through here, and let that little tennis ball hit this point. Then inch it down slowly, and sit down. You're actually sitting on this one little ball, and you kind of inch down the sciatic nerve, but I wanted to show you what you have to do so you can do it yourself. You'll be sitting on the ball, letting gravity put pressure along that point, and you can just work all the way down here, all the way down here. So you're basically sitting on a chair or something with the little ball sitting up on the nerve, and you're just pushing it all the way down. And then with the calf, you could massage yourself, the bottom part, all the way down to the foot. So it's a little more difficult, but you could do it yourself. That's the technique to fix sciatica. So remember, the key to getting rid of sciatica is to work on the opposite side of the sciatic nerve. Don't work on the same side, because that's just going to make it worse. Work on the opposite side and use the technique I showed you. Also, keep in mind that sciatica is not just a matter of the sciatic nerve being pinched or irritated. It's often a sign of a deeper issue, such as a problem with the piriformis muscle or the sacroiliac joint. So if you're experiencing sciatica, don't just try to treat the symptoms. Try to address the underlying cause of the problem. And of course, consult with a healthcare professional if you're not sure what's causing your sciatica. Thanks for watching, and I'll see you in the next video. And if you like this video, do not forget to subscribe the channel and press the bell icon so not miss new videos.